we're breaking down some of the assessments and treatments that we were doing with past players in the past few days throughout the playoffs. And, really what we're seeing is a lot of common themes. Here, this is a session that Brian and I collaborated on. And so what we're looking at here is Jason just doing full body rotation. So we appreciate the rotation all the way from the foot to the knee to the hip, all the way to the spine. And then here we use the table test to also look at hip range of motion, just to give us a little bit of appreciation of the space in his hip. And then we do this push-pull test to see his ability to feel connected and grounded into the floor, which is kind of cool because you can use this test throughout a session to see how well an athlete is actually integrating some of the movement work into the floor, and they actually get a subjective feel like, oh man, yeah, I feel a little more connected. So really important reassessment. And then here, me and Brian are kind of going through what we call almost like a hip shift, and here Brian's actually helping me kind of tighten up my cueing, which is kind of cool because here, Jason is essentially working on getting his hip shift to the left and hip shift to the right, which is really important for pelvic and hip mobility. Now with Jeremy, here I'm giving him a little bit of help and getting him rotating his pelvis and his rib cage towards that bottom side. And I love this because I can actually use a little bit of force to mobilize his hip and also mobilize his rib cage while he's also actively working. So because of the time constraint and all the things that we need to work on between game days, post game, I have to be very selective about what drill I want to pull from, because I want to respect his energy, his conservation for not just the physical stuff, but also how does he recover mentally, emotionally, spiritually after a game. I need to do what I can in a short amount of time just so he can rest. And so, yeah, that drill, I get a lot from it. And then AD, with this drill, just helping him literally just kind of own the floating heel position, which is helping him resupinate the foot, which is creating that arch and then integrating it with the knee and then the hip. And then we just take him into open court and just getting him to feel the flow of feeling that big toe as he moves through space.